Hi, for yet another episode with Dr. Pankaj Talwar. All of you know Dr. Pankaj Talwar, professor, who's a very renowned person, and many of us have got trained under you, sir. I'm very, very happy to moderate this session with you. And to know about Dr. Pankaj Talwar, I'm just reinforcing, which all of you know very well. He's a PhD in clinical embryology. He has been awarded Vishisht Seva Medal by the President of India for working in the field of infertility. Sir is director of IVF and Fertility Center and Men's Clinics at Gurugram. Also is the academic director of iSeat. It's a clinical embryology and ART training, IVF training and academy. I recently got trained under Sir, and this is a hybrid mode which you'll be seeing. It's really worth attending this course because I have learned a lot. We did have hands-on training, but small things. Sir describes it, teaches you so nicely, and as if you're a school student. It was really nice attending this particular course. Sir, I have attended the third course on IVF. It was really good. Over and above this, Sir is also a clinical director of clinical ART program that's here in Gurugram University. He's Dean Department of Clinical Embryology and Reproductive Sciences, Sridhar University, Pilani. He's advisor for Doc Infra IVF Consultancy. He has run around 200 and 250 courses, which is enrolled for over 23 countries, and he has already spent 8,000 hours training people in the hybrid mode. And you won't believe 25,000 doctors across the globe have been trained by Sir. And I think, Sir, this is a very big achievement. He has had 10 orations and 4 lifetime achievement awards. To get one itself is so difficult. 4 is really great, Sir. And over and above this, being a great teacher, he's also published a lot of books. He's edited 9 books, and he has over 150 publications. And he has lot of experience in setting ART units across. It's not just in India, across the globe. He has helped in setting up around 29 centers across the globe, and he's got the Best Armed Forces Project and Research Paper Award from Director General Armed Forces in 2011 and 2012. He's got an Fertility Award for his excellence and National Award in 2024 for Voice of Health. He has conducted around 250 live workshops, and one of those workshops I met Sir in 2017, which was at Jipma Pondicherry. Very nice, sir. We have seen you doing the ovarian tissue freezing live, and we have been trained in that. It was really good. And of course, sir is pioneer in ovarian tissue freezing in the country. He is the leading gynecologist in North India. And to talk about his past, sir has been past HOD and director of ART services at Army and Navy hospitals and Birla Fertility. So much from you, sir. I mean, I think it's a proud moment for me that I'm moderating this session on a very important topic, which is called polycystic ovarian syndrome, which I think the term is used by everyone and anyone without knowing what exactly it is. So, sir, I would like you to say a few words before I ask you some questions. I'm sure many of you people are waiting to hear from you.
Thank you so much, Dr. Latha. I mean, it's a great honor to be back today, and very great to have you with me today. I mean, in fact, I respect you immensely. I mean, you are the president head of JIPMER Pondicherry, and I always have very good memories of visiting JIPMER some time back.
Yes, sir. Yes, sir.
So, if look at how things move in the life, why this particular topic I have picked up today. Normally, we connect every 15 days for a session. We have a Facebook Live session, and we talk about various topics which interest all of us.
Yes, sir.
So, at the very onset, we had last week, 10 days back, we had a topic on how to have how do we price an IVF or an IUI cycle. So, we pick up small topics which help everyone. And the fundamental here is that we don't want to go into the biggest details, but we want to connect with everyone so that they evolve with us. That's the main point. So आज का topic है, we have taken up a topic like simple like what is PCOS, what is PCOD. बहुत commonly आजकल everyone, lot of people come and tell us मुझे PCOD है, मुझे PCOS है, and there are multiple ways people are treating them. So my aim today, go through the whole journey of PCOS from childhood to elderly women. How we can help the people. I just bring to
Yes.
you two simple case scenarios which actually prompted me to go in on a topic like PCOS. I'm this point of time I'm having two young girls. They're both around. One is around what, 32. Her AMH is 14.4. 14.4 is her AMH. Very qualified girl, and she is so worked up about her PCO that why she's not conceiving. Probably the issue is that these girls they don't know when they are ovulating. Because with LPH, with having a AMH of 11.4, 11.5, getting a period every 2 or 3 months, and when they have irregular periods, they're not able to come because we don't know when they are ovulating. I have one more girl with AMH of 8, which I am seeing now. She also gets her periods after every 3 to 4 months. Again, same problem.
Yeah.
Or the thing which actually hurts me is that a large number of us we are advising them to undergo IVF. We feel that they should undergo an IVF and that will help them. So that is not the right answer.
Yes.
PCO patients they don't need any IVF. They don't even need IUI. They just need a
Yes.
need gentle counseling and to find out when we have to actually tell them to have a contact with each other. So that's the fundamental. So with this in background, I like to welcome all of you who are here. I'm sure that a lot of our friends, our colleagues, our patients would have joined today to know more about the disease. So we have a chat box. You can keep writing your queries here, which we can take later. So feel free to interact with us and we'll give you some answer. So with this, I'll come back to you, Latha. You can take it on and we'll take few common queries which people ask you and ask me sitting in Delhi and in Pondicherry.
Yes, as you said, we get lot of young women. I mean, hardly 18, 19 years who are married, and especially in this thing for them, marriage means next to conceive. So because they don't conceive and they keep thinking, okay, I have PCOS. So first thing I wanted to ask, do all women with irregular cycles have is equal to PCOS? Is it like that, or is it always PCOS, or even otherwise people can have irregular cycles? So
No, I think the PCOS they normally see normally PCOS जो condition है. These are young girls who come to us with irregular periods.
yes.
Very commonly, they come to us with irregular periods, and when they come to us, they have multiple other presentations also.
Yeah.
But irregular periods is one of the commonest presentations which we get. But very they are difficult to find the people who have got normal periods and still having PCOS. Normally, women who come to
Yes.
us, they are having, we call it anovulation. So they are
Yeah.
ovulating late. So
Yes.
when they ovulate late, they get delayed periods, and so irregular periods are part and parcel of the people who have got PCOS.
So one more thing I have come across is many of these girls जो लोग आते हैं बच्चियां हैं इतना नहीं कि उम्र भी हो गई है सब लोग बोलते हैं डॉक्टर ने बोला उनका रेगुलर साइकिल्स होता है डॉक्टर ने बोला मेरे को पीसीओएस है ऐसे ऐसा नहीं होता है कि रेगुलर साइकिल्स हो इफ यू सी पॉलिसिस्टिक ओवरीज काफी लोगों में हो सकता है दूसरा ऐसा नहीं है कि सबको जिसका पॉलिसिस्टिक ओवरीज हो उनका पीसीओएस होना चाहिए I mean, is it something which you come across? I mean, many of them
No,
have this.
rarely, madam, rarely. Because you understand one thing, there is a possibility, like for to diagnose PCOS, there are three criteria. So, जो भी हमारे भाई बहन हमारे साथ जुड़े हैं आज, we have got 30 people who have joined. So, thank you so much for being with us. And I think we'll take you on a lovely journey of around half an hour. I can see Shivani online. Hi, Shivani. Good to see you there. So, remember, a girl can have two features or three features. You know, three when two come positive, we say she's got PCOS. सबसे पहले अगर that girl has got irregular periods, then we say she may be having PCOS.
Yes.
The third is that she's got some facial hair growth. So you'll find that large number of girls have got some amount of facial hair growth. Like the pattern the man has, some amount of beard, oily skin. You'll find them. I normally find a lot of speckles here on their forehead,
Yeah.
oily forehead, and they also have got brittle hair. So how I look at these people is that they've got bitter hairs. So when I look at a woman, we don't look at the woman and go to her ovaries directly, Latha. I think we should see her,
Profile.
from head to toe. And I find that such women have brittle hairs. You know, bal, they're not settled. They are breaking. They break. Hairs break. Number one, they've got oily skin. They've got some sort of pimples. They've got very shiny face, and on the forehead and the sides you find some amount of acne on the forehead, and you also find that they are removing hairs from here. You find they're undergoing some epilation. A large number of girls go to cosmetologists and they undergo laser. मुझे
Yeah.
समझ में नहीं आता कि लेजर क्यों करते हैं. They don't treat the basic pathology. They don't. It's like a pressure cooker. When I tell my
Mm.
young girls come to me that you're like a pressure cooker, they say क्या बात कर रहे हैं, बट जब उनकी बॉडी में इतने हॉर्मोन्स इकट्ठे हो जाते हैं, यू टू रिलीज दैट प्रेशर, एंड
Mm.
द मोमेंट निकलेगा दे सेटल डाउन, एंड दैट कैन बी डन बाय गिविंग देम सम सॉर्ट ऑफ ओसी पिल्स और regularizing them. And third is that they may come to us either obese with high BMI, and they can be thin PCOS also. And then there's a reason when we do a TBS scanning, they will have polycystic ovaries, multiple
Mm.
follicles here. Very, very rare, though theoretically possible, that a woman may not have polycystic ovaries. But in such women, a theta component will be very high. Ovary में जो theta component that goes very high. That makes more androgens. So तीन में से दो चीजें मिलने पे we say that she can have PCOS. तो पहली बात था that she can be having irregular periods.
Yes.
Second, she'll have some sort of male pattern of hair growth, and thirdly she may be having some sort of thing like when her periods are irregular. So ओवरी में फॉलिकल होना, चेहरे पे
Mm.
बाल होना, हम चेहरा ही चेक कर पाते हैं, but they can have peri-oreolar hair growth also. It can be done on the thighs, breast, it can be there, but we look at the face only. तो
Mm.
तीन में से दो चीजें होने पे we say that they have got PCOS. But in our population, these young girls who come to us, they have irregular periods. And then along with that, they can have polycystic ovaries as well as they normally
Yes.
have all the three features, but they can be obese, they can be thin.
Thin. Sir, agar once they are diagnosed as PCOS, is it always necessary that we should treat them giving, usually we give oral contraceptive pills. Is it necessary
Uh,
to treat all of them?
yes, so I'll come to that. इससे पहले एक सवाल है शिवानी का.
Achha.
Shivani ji लिखती हैं, Shivani writes, "Hi Archana, hi KP, good to see you guys here." So Shivani is writing that hyperprolactinemia, thyroid disorders. Agreed. PCOD के तीन तीन भाई बहन हैं. PCOD जब होता है उसके तीन तीन भाई बहन होते हैं. So PCOD के साथ में once they diagnose it, they'll have hypothyroidism. Their TSH is low. Their levels of prolactin go high, and vitamin D is low. This is
Yes.
my experience. They got hypovitaminosis, vitamin D, vitamin D3 hypovitaminosis. They've got prolactin high and
Fine.
TSH low. बट अभी हमें देखना है कि हमें क्या ट्रीट करना है. सो वी स्टार्ट ट्रीटिंग थायराइड एंड प्रोलैक्टिन टुगेदर. But I think we should treat PCOS. And once we treat
PCOS.
PCOS, they all fall together. But
Yeah.
yes, they are known to be having low vitamin D levels, so we should give them vitamin D treatment also. But Shivani has written that CAH androgen dependent. So here, Shivani, I always say that I agree. But in my whole career, ma'am, in my whole career, I've never found an androgen producing neoplasm or a CH in the young population. I know it's a DD, but in our population, I say around till 30, 35, I don't get CH. So मैं कहना ही चाहूँगा कि don't start treating people for CH. I find a girl coming with PCOS and we start thinking about CAH, congenital adrenal hyperplasia, and we start sending them for ultrasounds. We start doing their 17 beta hydroxylase. We start doing so many things for them which they don't need. I've seen people ordering for fasting insulin, postprandial insulin. कहाँ पे? Madam, you have been the HOD and the prof of the most prestigious medical college of the country. आप मेरे को बताएं मैम आपके कैरियर में कितने यंग गर्ल्स में ये फाउंड एन एड्रेनल ट्यूमर? आई जस्ट वांट टू आस्क यू, मुझे कभी नहीं
Well,
मिला, मैंने
I
ऑफिस में
mean,
काम
I
किया,
hardly have seen, sir. I mean, adrenal
हाँ,
tumor, hardly. I mean,
नहीं
I'm
मिलता
not
है.
sure rather. वही तो.
सो आई थिंक हम सबको ना एक प्रण करना है दैट वी शुड ट्रीट कॉमन थिंग्स कॉमन फर्स्ट.
Yes, yes,
माइंड में रखो हर कॉम्प्लिकेशन को, बट कॉमन चीजों को पहले ट्रीट करो. यंग गर्ल्स इरेगुलर पीरियड्स, पॉलिसिस्टिक ओवरीज दिख जाती हैं, इट इज ए केस ऑफ ए प्लेन सिंपल PCOS, and that's the way we manage them. And for them, we don't need any big investigations. Just treat them like a little girl who needs care, and just do her hand holding. She needs tender loving care, and that's all she needs. Don't
yes.
try to. I've seen many people ordering for PCO panels. They do
Mm,
PCO panels nowadays, you know. PCO दिखा 15 इन्वेस्टिगेशन कर देंगे. They'll do their oral GTT, they'll do 100 things. I think
yes,
they're not
not
needed.
necessary.
Neither their advice. Treat them like a girl has got a problem. That's all we need. So don't over investigate, don't overbill them, and don't think about complications. And that's all from my side. And I think I'll say hi to Anuradha soon. Hi Anuradha, good to see you here. Sanjoy, please feel free to interject. It's our community. Please feel to give your remarks. Shivani is writing, think PCOs are difficult to manage and obese. I fully agree with you. So मेरे ख्याल से शिवानी, जो हमारी पंजाबी पीसीओस होती हैं, सो मैं बड़ा आई एम इन आर्मी नो, आई वाज इन आर्मी, सो मैं आई बीन ऑल ओवर द कंट्री. So North India, Punjab, Jalandhar, you'll find thin PCOS. And as you go towards South, you'll find short statured, obese PCOS, the South Indians. I think the PCOS who are thin, they are very easy to handle in terms of ovum pickup because you'll find lovely ovaries there. But in a
Yeah,
short statured PCOS, when you do their IVF, they're difficult to do IVF because ovaries are big,
but
they're obese, and they're always breathing because you know. बट मेरे जो मैंने देखा है इनके इन केसेस के अंदर when doing the ovum pickup ना, they are they are breathing all the time. So we
yes,
have to intubate them. But Punjabi PCOs, North Indian PCOs are very easy to operate. But yes, they have got high chance of undergoing ovarian hyperstimulation. They respond very badly as compared to the. So I agree with Shivani here. So I think she's right. Thin PCOs are difficult to manage in terms of infertility. Don't take them for granted. Don't take them lightly. They can create problems for us. That's a big challenge which we have.
so एक और बात है सी many of these women come PCOS जो diagnose हुए हैं they are worried that they may not conceive, they will never conceive ऐसे like they have been told and they said is it necessary for me to conceive immediately or is there any time limit for which I can wait. ये हमेशा ये सवाल होती रहती है हमारे पेशेंट्स में. How do
हाँ,
we get such patients?
एक्चुअली पता क्या है लता, द प्रॉब्लम इज विद आवर स्कूलिंग, द प्रॉब्लम इज विद आवर पेरेंटिंग, पेरेंटिंग एंड स्कूलिंग. पीसीओ जो है वो 10 से 15% लोगों में मिलता है, यू नो, इट्स कॉमन
Mm,
कंडीशन. एंड व्हेन वी
yes,
हैव इनफर्टिलिटी, अब इनफर्टिलिटी तो हम एक तरह का डायग्नोसिस उनके माथे पे लिख देते हैं इनफर्टिलिटी है. बट इनफर्टिलिटी वाले केसेस के अंदर ओपीडी में इट मे टर्न टच अराउंड 35-40% ऑफ पीपल में है माय ओपीडी. रिमेंबर, problem is not with what they are saying. Problem is what, as a mother, as a father, what I tell my daughter, or as a teacher, what they tell their students. That's the main problem. Because हम हर एक गर्ल को और एक बॉय को प्रोग्राम करते हैं कि शादी होने के बाद बहुत जल्दी यू शुड हैव ए चाइल्ड. नंबर वन, प्रोग्राम देम. And how do we program them? That your safe period is what? So Lata, आप क्या बताते हैं? What is the safe? What is the I mean unsafe period to conceive? क्या डे बताते हैं सबको आप?
हाँ, usually if it is a 20-day cycle ऐसे बोलते कि 10th day I mean around 14th day before the periods they'll usually have ovulation so you have to conceive. तो
Ah,
उनमें से it's easier to tell but if it
exactly.
is an irregular cycle then it is very difficult to say that but I also tell them ऐसा नहीं कि आप conceive नहीं करोगे. ओनली थिंग इज थोड़ा डिले हो सकता है आपका 45 डेज 50 डेज साइकिल है तो थोड़ा डिले करके आपको उस टाइम पे यू विल हैव टू आई मीन आई जस्ट टेल देम देन 14 डेज बिफोर ओनली
Perfect.
थिंग इज
So,
या
so Lata, perfect. But this coming from the gynecologist. I'm talking about the mothers. See, as
Yes.
a gynecologist also, you need to think, no, I need to think
Yes.
क्या बोलना है मुझे patients को. But look at the mother. A mother of a young girl who's 18, 19, 20, she doesn't know. Girls, they normally they ठीक हो जाएंगे शादी के बाद में periods.
Hmm.
Or the boys, they don't know. All the friends, they say the right period is say day 12 to day 14, day 15. In 4-5 दिन में साथ में रहो, you will have a child. Isn't it? Normally we tell people. So वो couples साथ में रह रहे हैं, एक प्रोग्रामेबल वे में रह रहे हैं, बट उससे बात बनेगी नहीं बिकॉज शी इज ओवुलेटिंग. अगर उसका पीरियड अगर सेकंड 60 days और 45 days, शी इज. सो एक चीज हमें सबको समझनी है आज. So all my friends who are there, I can see Veera is there, then I can see Moksh. So guys, Sanjay, Anuradha, Shivani, we have to understand that in a period, अगर वो है 30 days का, तो last 15 days are fixed. Agar periods are for 45 days, then again 15 days are fixed. 60 days, matlab last 15 are fixed. So, ovulation will occur on just before 15 days of the period starting. So, हमको उस समय वो girls ovulate कर रही हैं. So, I think so. The important part is that the parents should guide their girls. I should tell my daughter. We should all tell our children and our relatives. The teacher should tell the girls in the college, in the education part, अगर आपके पीरियड्स इरेगुलर हैं, सो आपका जो नॉर्मल ओवुलेटरी पीरियड होता है ऑफ कंसेप्शन दैट विल डिफर. They are ovulating on 45th day in a 60-day cycle. They are ovulating on 30th day on a 45-day cycle. This thing should be told to them. And once it is told to them, it will take away a lot of stress from them. This is what is important here. So, होता क्या है लता मैडम, that a patient of PCOS, we are confused. उनका AMH high है. What do we do? So immediately we try to, many people, I may be wrong, but many of these girls they come, मेरा IVF कर दो या मेरा IUI कर दो. Because उसके अंदर क्या है कि it's very easy to regulate the cycles. So in case I told you two examples of two young girls who are coming to me, and both are in corporate, they are doing very well in Gurugram. अब इन दोनों के दोनों दोनों बच्चों के साथ में क्या प्रॉब्लम हो रही है? They are married, they are trying to conceive. और अगर उनको हम एक सिंपल जर्नी पे लेके चलते हैं टू टू मॉनिटर देयर ओवुलेशन, इट्स अ लॉन्ग जर्नी. It's a long journey, no, to make them ovulate, which
Yes.
they lose their patience sometimes. They ovulate और अभी कुछ लोग करते हैं LH टेस्ट करते हैं ना, LH में यूरिन में LH चेक करते रहते हैं. अरे कब तक चेक करेंगे? आप सोचिए कि एक गर्ल आफ्टर 15 डेज एवरी डे मॉर्निंग इवनिंग LH किट चेक कर रही है, वो थक जाएगी उस समय के अंदर. खर्चा भी आता है. तो अदर वेज दैट वी डू देयर अल्ट्रासाउंड एवरी 6-7 days, so more number of scans are required, more expenditure is required. But ये आसान तरीका है करने का. I think we should be doing their follicle monitoring and telling them what day are they'll be ovulating and then they have to have a timed intercourse. But एक बहुत अच्छा तरीका है ये जो लिखा है अभी अनुराधा ने लिखा है. अनुराधा, I like your funda which you have written. We going for, आप इसे पढ़ पा रही हैं लता? अनुराधा is writing on the screen. You go to the comments part.
No, I'm
She's
not
written,
able to do so.
we can go for natural follicular study and diagnose late ovulation. इसके अंदर एक ही प्रॉब्लम होती है अनुराधा कि अगर हमने पीरियड्स को रेगुलेट नहीं करा पेशेंट्स के और हमने 45-60 डेज के लेवल पर ही खेलते रहे कि चलो हम उसे मॉनिटर कर रहे हैं, सम टाइम दे विल गेट सिक ऑफ मल्टीपल अल्ट्रासाउंड्स एंड दे विल गेट सिक ऑफ LH टेस्टिंग फॉर देम, and then they may lose interest in themselves only. So I think the right way is from my side. जो आपने बात बोली, I'm coming back to Latha now. Then we'll take few questions of Moksh and Vera. जो लता
Yes.
मैडम ने बोला कि should we give them OC pills to regularize their periods? I personally feel that in a patient who has got this sort of a problem, we should always look at them with a lot of diligence and try to make their periods regular. कुछ तरीके होते हैं इसके, what to normally do, and to make their periods regular, we need to first of all go in for look at their BMI. हम उनका BMI हमें पता रहना चाहिए. We have to look at their AMH. यहाँ पे एम एच हमें करना होता है, वी नीड टू देयर एम एच, वेरी वेरी इंपॉर्टेंट. वी शुड नो देयर एंटर फॉलिकुलर काउंट, we look at their body mass index, मैंने पहले बता दिया. Then we should try to make them lose weight. अब इसके बड़े बड़े फॉर्मूले हैं. हफ्ते में कितने घंटे, हफ्ते में कितना वॉक करना है, हफ्ते में 2 बार 1 1 घंटा वॉक करना है. सम पीपल से वॉक फॉर 150 मिनट्स पर डे. आप मेरे पास सुन पा रही हैं लता?
हाँ
So
सर, हाँ सर.
that makes the
Very
life very very complicated for them. They don't know what to do. But I think we have to go in for lifestyle modification first. The first thing to do to make them ovulate is to bring lifestyle modifications, and for them, I feel that they should relax, lose some weight, even for a thin PCO. अब हम कहते हैं कि थिन पीसीओ का तो वेट ज़्यादा है ही नहीं, तो वो क्या करेंगी? आई थिंक दे शुड ऑल्सो वॉक. When they walk, exercise will increase their metabolism, and then they will lose weight. They will ovulate earlier. Treat their thyroid. Don't treat, for God's sake. Don't treat their prolactin. Treat thyroid in case required, and prolactin will fall into place themselves. And then इसके साथ में, in case they're not responding, periods are still irregular, I think we should always give them some sort of medication. Many people give metformin. Many people give drug like hyponate. Many people give multiple drugs which are available nowadays, which can make the periods regular. Some people give DCI, MCI combinations. I think the right way is, these things, drugs are all empirical drugs. I think we should make them. I feel we should make them lose weight. Metformin is one drug many people add, but metformin is not recommended. We shouldn't give anyone
Yes.
metformin till the time they have got glucose glycemic index deformity. Never give anyone metformin. We give metformin only to avoid ovarian hyperstimulation. We don't give metformin to all, but giving metformin may not harm them. We won't even give them.
Yeah.
But metformin is given normally when they have got any glucose intolerance, not for all the patients. So I do feel, what I do in my practice, a lot of debates are
Yes.
there. जो मैंने आपको बताया मैम, मुझे लगता है कि these women are under a lot of stress. Something like, they have
Yes.
got like a pressure cooker. They're full of hormones. You have to just open them. Just by giving them some OC pills, we can just we can just open them in some time, and as they open up, they will feel better. We'll just open the flask, they will better. And for that, we have to give them drugs like, we can give them OC pills. I'm I use, many people don't use. I use a drug like, use something like a Dine tablet. Dine can be given with contains cyproton acetate and ethylene
Yes.
instead of OC pills. Make their periods regular.
Yeah.
सबसे बड़ी बात जो होती है, अगर हमने उनके पीरियड्स को रेगुलर कर दिया, she'll gain her confidence. These girls are under so much of mental trauma that 45 days, 1 month, 2 months they don't ovulate. अगर हमने इनके पीरियड्स को रेगुलराइज कर दिया, by any means, they feel very very happy. This is what I do: lifestyle, losing weight, and making them ovulate. And once they ovulate 2 3 times back to back, their whole, you find their acne are disappearing. They feel more happy. They'll feel like कि मेरे को भी periods आते हैं. लेकिन ये चीजें करनी बड़ी जरूरी है. Then to just follow them in a natural cycle and keep doing their ultrasound is what I do in my practice. What do you
Very
do?
true, sir. Yes,
What do you
very
do
true,
in
sir. Maybe we continue first 6 months, especially young people. I never tell them OC pills. First, I tell them reduce weight by telling what I mean. Simple things like walking, jo bhi hai, cycling ho, skipping ho, whatever. Sometimes I even tell them to do Zumba because I myself have done. Seeing that there is definite loss of weight is there, and I also tell something about the diet which they take. I feel even diet is very important. Low fat, definitely yes. Tell them to take lot of proteins and maybe antioxidants in the form of amla and fruits like guava and things like that, which I feel are very good, or pomegranate which has calcium. So this is something which I tell them. Of course, non-vegetarians, I tell them
Correct.
to decrease the amount of oil, but then yes, so these things we tell them even in for especially for the mothers. It's not just only for children. उनको भी बताते हैं because mothers tell me आप बताओ मेरी बेटी को जब मैं बोलती हूँ वो सुनती नहीं है. So I
Correct.
do a lot of counseling for these people when they come. So I, as you rightly said, lifestyle modifications. Yes, अभी कुछ 6 महीना देती हूँ सर डेफिनेटली. अगर कुछ भी वेट कम नहीं हुआ देन, and if they don't get periods at all for more than 3 to 4 months, then yes, we'll think of
Correct,
visiting.
correct,
That is
correct,
not the
correct,
first thing.
correct,
So
correct, correct,
uh,
correct, correct.
अभी एक और बात है, these PCOS patients do become pregnant. वो तो है, it's not that we see at least around 70% of them become pregnant. It's just those 30% who have problems in becoming pregnant. अगर pregnancy हो गई तो उनका क्या complications हो सकती है सर? We do come across these patients
Yeah.
quite often.
So PCOS के अंदर the complications are, actually they have high chance of having more abortions because they have got they are, देखो, आप सब लोग आज हमारे साथ जुड़े हैं ना, एंड सब लोग हम एक दूसरे को जानते हैं, कहीं ना कहीं मिले हैं, पेशेंट्स होंगे. सो इन वुमेन के अंदर they have got hyperandrogenism and they are LH hypersecretories. And the levels of E2 are also very high in such cases. Such women, there's a chance that they'll have more chances of having abortions. Number one. Then they can have pregnancy complications. I think they have more chance of developing babies which are bigger. We call them, macrosomias can occur. I think when the babies have more weight. Babies they can have IUGR also. Babies can be smaller also here.
Yes.
They can have preterm labor. So PCOS can go into any directions, and they can have polyhydramnios. They can have, multiple things can be there. I think what we should do when we have to diagnose them early. So when they become pregnant, there are two ways. So I feel I may have to continue metformin for them. That is number one. Number two, please carry out their oral GDT at very, very frequent intervals. And when in case they find that in case the glucose is not being controlled by oral diabetogens, in the pregnancy as such, we can give them injectable insulins to control their sugars properly. I think so. We have to be very careful. Oral से convert करना पड़ सकता है उनको on subcute insulin
Insulin.
that we can do, and what ratios to be given. But we have to keep a strict watch. And I personally feel that now at my seniority and age, type of work I do, I always tell them to, I send my patients who become pregnant with PCOS who've got altered blood sugar to an fetal medicines people who can really give them better care. They're called high risk obstetrics. So don't want to miss anything in them, so they can give them a better treatment. But yes, they need I do send them for a consultation of a fetal-maternal or a high-risk obstetrician, or I take consultation of a endocrinologist, so that we are able to control their diabetes better. But they can have large number of complications preterm. They can go into, they can have polyhydramnios, they can have IUGR, they can have macrosomias. These are for the fetus. And the ladies, their diabetes can go uncontrolled. They can develop, we call it gestational diabetes mellitus. GDM कहते हैं इसको हम. They can develop hypertension. So all these things can occur in them. I think they should go to the right doctor. And
Yes.
all of us are doing IVF here. I think we should send our patients to the right doctors here so that they can take better care of them.
As you said, very rightly said, sir, diabetes is quite common. In fact, the first visit itself, we do a GTT and repeat them at 20 to 24 weeks, then at 28 weeks. This is necessary, especially for PCOS. And India being a diabetic capital, now we are doing for all pregnant mothers and
All
PCOS.
pregnant.
Yeah.
Correct.
So that is the thing. So
डोंट स्केयर देम. उनको डराओ मत, उनको खाली
no,
डराना
no,
नहीं है.
डराना तो नहीं है, बट ये तो करते हैं एज अ रूटीन, इट इज डन.
We
वो
should
तो
do. We should do.
लेकिन वो लोग ही पूछते हैं हमें
Correct.
इवन बिफोर we tell them. They ask. Now people are very
Correct.
well informed about lot of
Correct.
things, especially when they have
Correct.
this PCOS.
Correct. Correct.
So pregnancy में is it necessary to take any particular diet or whatever they were taking earlier until unless they develop diabetes? That is a different issue.
I
Otherwise,
think they are at high risk of developing gestational diabetes mellitus. That we
yes,
already know, and I think we
yes,
should take the consultation of. But we have to give them right amount of calories also, so that they don't, they underconsume or overconsume. Both are the problems. They shouldn't overconsume or underconsume. I think they should. What I normally do, ma'am, I do send them to a dietitian to make their
yes,
dietary chart, and that's very, very important that they should have. Simply हम जो कहते हैं, they should not have any processed foods.
true,
They
sir.
should have more of fresh foods.
Fresh
Try
food.
to avoid taking unnecessary sugar, rice. Don't take foods which have got very high caloric indices.
Yes.
Don't take foods. I normally wear a simple fundamental. Okay, don't take food which is very white.
Yes.
So desi ghee, I'd say take desi ghee, but normally for other like sugar, bread, lot of white butter, they should
Yes.
avoid.
Avoid.
Shouldn't be taken.
So something which we very commonly get in South India is the drumstick leaves. Very healthy. It has
Acha.
iron, it has protein, and it's very freely available. In fact, even I have it in my house. Like it's something which we tell them, but I agree it's difficult to cook that because it has a lot of small fibers. But that is one of the diets which generally people in South India, especially in Tamil Nadu, people have.
Correct,
So
correct.
going to other questions. Some people feel that if PCOS is there for the mother, the siblings and the children can develop. Is it so, sir? Does it run in families?
Yes, it's multifactorial, madam. It's a multifactorial condition. What
So
are the multifactorial condition? Maybe multiple factors. So PCOS can run in the families. First of all, PCOS can run in the families. PCOS can have a genetic predisposition.
yes,
But एक जेनेटिक प्रीडिस्पोजिशन होना इज समथिंग डिफरेंट बट उसको एग्रीवेट करेगा लाइफस्टाइल डिसऑर्डर्स सो पीसीओएस कैन रन इन द फैमिलीज there's some
yes,
genes which can run in the families and cause PCOS, but they will only get aggravated normally when we have got bad lifestyle. See, in case we have proper diet, we have proper disciplined life, we do say, my simple is walking 10,000 steps per day. Without complicating anything, I say walk 10,000 steps a day, you'll become fine. So, in case somebody takes drinks, they take alcohol, they don't watch their weight, they do binge eating, then these multifactorial things. So, जो genetic
yes.
वाला component जो थोड़ा दब रहा है उसको उठा देंगे उसको. So
So one more
PCOS,
thing,
yes,
yes, sir.
correct.
So you
I
carry
want
on. You tell me.
So I think we should when somebody has got gentle predilection towards having PCOS, we should. बड़ा अच्छा लिखा है शिवानी ने. Shivani, thank you so much for this. Treatment should start just after puberty if there are irregularities or ovulation dysfunction or hyperandrogenism or frank PCOS. So we should start treatment that point of time only. Then by the lifestyle modification. See, I being in the army now, we see a lot of fit people. I've been in the army for 30 years. Many girls had PCOS, but then they decided we got PCOS, we'll have difficulty, we'll gain weight. And then when you gain weight, the uniform can give you a problem, or they have to they have to travel all over the country and the world now. So the army girls are always fit. They go to the gym, they work out, they have very good dietary control, and as a result, they themselves, even PCOS is there, they don't let it hit them hard.
That was my
They
next question, actually. I
huh,
was about to ask you whether it can be prevented. As Shivani rightly said, we should start the tell the mothers that because they've had or their siblings had, let the others start this exercise or diet, right? As you said, right from the time when they attain menarche, so that
yeah.
it can be prevented further. As you very rightly said,
Prevented, no, madam. So I know about army. I've seen 30 years as a gynecologist, as guy in green uniform. Our girls were always so active. No, the moment PCO का पता चलता है, तो they start running. घंटा सुबह जिम, घंटा शाम को जिम, अच्छा खाना खाना, खुश रहना. That's a PCO is controlled. अगर वो नहीं करेगा, then PCO like I told you, right? Like a pressure cooker. And once it
yes,
starts, you start gaining weight, you start having more hyperandrogenism, फिर चेहरे पे start getting some hair growth, and then you get caught in that circle. You can't leave that only. So I think that's important.
yes.
Self
So
care is very important.
yes.
Very important. Yes, ma'am.
Another thing, sir, if a woman becomes pregnant, she had irregular cycles, she was diagnosed as PCOS, whether with ovulation induction or spontaneously she's conceived. Is that the end of the story, or will she continue to have PCOS later, or is likely to have these problems continuing? Because some people feel once they become pregnant, all these problems will get solved.
No, I think PCOS people PCOS can not go, man.
Yes,
So PCOS like endometriosis. See, we
yes,
always say कि what is the right way to treat endometriosis? They get pregnant.
yes,
आप भी शायद बोलते होंगे to treat endometriosis, get pregnant. But getting pregnant will reduce the chance of endometriosis. मतलब it won't. it it'll suppress it for some more time, but after some time it'll come back again. Same with PCOS. Pregnancy के
Yeah.
बाद में in case they can fight all the things, it doesn't go away. It is always there
Yeah.
because the pathology is in the ovaries. It won't go away. But definitely
Yes.
yes. And सबसे बड़ी problem. And so I'll take over this. I'll take everyone's question here, ma'am. So I think so. I'll just pick up on my dear friend.
So just one thing, I just wanted to add a comment. So in patients with PCOS, it's very important that they have at least 4 periods a year because these have long-term problems like developing endometrial carcinoma and
Yes,
hypertension and diabetes later on.
correct,
And
correct.
most important is they need to get their periods at least every quarterly. I just wanted to give this comment before you take
Absolutely,
over.
madam. I agree. I say why not 6, 7, 8 periods? Because now drugs are there, we can change them. And ma'am, सबसे बड़ी चीज लता, Dr.
Yeah.
Lata, is that when this woman get pregnant, no, all the care they take care and everyone around them takes care.
Yes.
After they deliver, they say, okay, अभी तो मम्मी बन गए. उसके बाद शुरू होती है प्रॉब्लम. That's the time they go into a rebound everything. They have rebound weight gain. They
Yes.
have rebound everything, rebound, and that's the time when they can't come out of it. So मैं आप सबको एक चीज बोलना चाहूँगा as an elder brother. I've got a lot of white hairs, so I've not lost them till now. So थोड़ा white hairs से यही कहना चाहूँगा सब अपने भाइयों और बहनों को that when the PCOS woman deliver, she needs more care than what she required before, because now initially it was getting pregnant, now it is looking after herself, because in case she doesn't look after herself now, then she'll go into a loop, she'll become gain so much of weight which is never she will be able to cover up only, and then she will go into grief, depression, and you know what I'm saying. So I think very important counseling should also be done after pregnancy. After pregnancy, also we should keep checking their blood sugars so that they don't that their GDM doesn't convert into diabetes mellitus. So ये care भी बड़ी जरूरी होती है for year or so that we have to normally we celebrate. हम मिठाई खाते हैं. We have done IUI और time intercourse. अभी celebrate करो नहीं. कम से कम 1 साल तक उनको अपने कंट्रोल में रखना है, उनको अच्छे से गाइड करना है. That's very very important so that they don't gain excessive weight and then they go into depression. सबको देख के मेरा वेट बड़ा हो गया, then they
Yes.
feel bad. That shouldn't happen.
So I'm not able to see the chat.
So should I chat? Is in the comment
Yes.
section, madam. You can see
Yes.
comment section.
Oh
So
yeah, comment में हुआ है. Yeah, yeah. It's there. So
so
sorry.
now you can open. I think we can take some questions in the comment section, ma'am. So we have taken to let's go to take a query from Moksha. So I'll like to see what he has written. I'm not able to see what he has written here completely. In PCOD, if AMH is 10.2, how to induce it? So that's the question. एक सवाल है शिवानी मैडम का will PCOS patients have raised LH? Yes, शिवानी. PCOS will have raised LH. तो ये बात मैं बार बार से बोलता हूँ. PCOS will have raised E2. And when the E2 is raised, when anyone has got raised E2, E2 का friend है LH. So LH will become raised. So they are normally LH hypersecretors. Second question from Moksh and Humisha. Pranksters. Nice. Okay, pranksters. So in PCOD patient, if the AMH is 10.2, how to induce it? Very simple. PCOD के अंदर ट्यूब्स ब्लॉक होने का चांस बहुत कम होता है. But yet, I like to carry out tubal testing for them. But you may not do for initial 2 or 3 months, but I do it. And then we can just make them lose weight, lifestyle modifications, make them ovulate, and in case they don't ovulate by themselves, you can always give them something like letrozole. I start with 2.5 milligram of letrozole for monofollicular growth. It doesn't work out, I may give it for 5 to 7 days. It doesn't work out, I may make it 5 milligrams per day. You need 2.5 milligram में 2 tablet for 5 to 7 days. It doesn't work out, I'll add HMG here. So कभी किसी भी तरह से please don't go. What Anuradha had said is the right method. Anuradha, so in case you are here, madam, just you can just say hello again. I agree what you said. Natural, but natural के लिए patient आपके साथ जुड़ा हुआ होना चाहिए. You shouldn't feel कि आप कुछ कर ही नहीं रहे हो उनके लिए, आप बुलाते हो और स्कैन करके भेज देते हो. So in case we look at what Dr. Anuradha Sood said, I think natural is the right method. We will keep following them. Perfect condition. But in case we can't do that, letrozole 2.5 milligram once a day, 5 to 7 days doesn't work out. Letrozole 5 milligrams, 5 to 7 days doesn't work out. From day 2 to day 5, day 2 to day 6 doesn't work out. Add HMG. This is what I will do after I've tried natural follicular study with complete ऐसा मतलब कि पेशेंट बोले कि आई एम चेंजिंग द डॉक्टर ओनली. आप क्या कर रहे हैं मुझे समझ में नहीं आ रहा है. एंड एवरी टाइम यू गिव हर 30 किट्स ऑफ एलएच किट्स व्हिच आर डूइंग मॉर्निंग इवनिंग, वो किट ही चेक कर रही है यूरिन के अंदर. So we be very careful about these things. That should not be done. So yes, madam. So when AMH is 10.2, be very careful. They can go into urinary hyperstimulation. They can have multiple pregnancies. They're very dangerous people. Just remember that. More than induction, Latha madam, problem is when do we stop? So
Yes.
many young girls of mine, PCOs are young girls. All my
Yes.
other OPDs are 40, 42, 43, 44 plus. But when I get a PCO patient, AMH of 14, 15, 18, they are all young girls. They are all 32, 33. They get married, they come to us. Just remember that I feel that always be very, very careful. Cancel the cycle. In case they got more than two follicles which are mature, till two, I carry on. In case they have two follicles which are mature, I am happy. But more than two, I just cancel the cycle. Because what will happen then, in case they have got 14, 15 millimeter follicles and two mature follicles, by the time no, they'll rupture and the couple will keep having intercourse. We tell them, no, आपस में संबंध बनाइए, साथ में रहिए. So they keep having intercourse and then that 14, 15 follicle, 13 millimeter follicle will also ovulate on after 1 week and then will also become pregnant. Or she may have multiple pregnancies. So be very careful about ovarian hyperstimulation. Secondary ovarian hyperstimulation can occur, Latha, here, and we can also have multiple pregnancy. Ma'am, this is my experience. आप क्या बताना चाहेंगे एज ए prof and such a senior gynecologist? What is your opinion about this?
So, as you said, I wait for some, depending on the age. Of course, we get a lot of patients after 35 years and all. In those patients, we don't wait. But if they're very young, less than 24, 25, I do wait for 6 months. If they're not considering, telling them this is the thing, then we start them an ovulation restriction. So, problem ye hai ki
Ye-
either it's not just the woman, it is her family, lot of strain on them, lot of stress on them that she's not becoming pregnant.
Yes, yes,
So depending on that, but if they are very young, I even tell them, you bring your mother-in-law, we'll talk to them, we'll counsel them and tell that it is not that they will not conceive, it's just that you need to have some, less of stress and concentrate on work. But yes, sometimes we have to go down to their families and think of them also. So lot of
correct, correct,
hardship for them. So ovulation induction is something very simple we can do. We don't go for IUIs and IVFs directly, but yes, ovulation induction after a certain age. So if less than
but with
20,
ultrasound monitoring, I've seen many people giving letrozole and then they feel that they can go. Don't leave the patient when you
yes, yes.
give any OC drugs. I mean oral ovulations, please for God's sake carry out their ultrasound. Don't let them go otherwise they
Definitely,
will.
sir. We call them back whenever they're on this thing. Call them back on day 11 or day 12, and then we
Yeah,
definitely call them. So, and
absolutely.
luckily, these patients come back to us because, being in a institute like JIPMA where we are
Yes.
giving free, so they definitely come back. So, we don't really lose patients. So,
I fully agree with you, madam. Fully agree with you. That's the
that's
way it
one
should be.
thing. Yes.
So, yoga can help. Ovaries plus RAIH, AMH. So, I think Ovaries plus has got DHEA, in case I'm not wrong. It's got some
Yes.
CoQs. So,
Yes.
Ovaries plus ka role, DHEA, is primarily for people who have got low LH. So we give it to the people who have got either low LH or defective LH. So we give it to the people who have got poor ovarian reserve. For PCO patients, many people give Ovarius Plus, but Ovarius Plus is a brand name. It contains DHEA. It should be given with a lot of discretion, not for all the. It's an antioxidant after all. Don't give it to all, is what I feel. Yoga will help. Barbitol, ma'am, no drug is allowed in PCOS. Actually, look at the HRA guidelines. Even metformin वो कहते हैं नहीं देना है. So I can't say that we give XYZ drugs. So avoid giving unnecessary drugs to the people. But nothing wrong. But we don't even DCI, MCI they don't recommend as per the HRA guidelines. We don't give. So coming to the next question, patient
So,
completed family
yeah.
want to get a regular cycle for hyper can cope. Yes, you can. You can give ciprotron acetate. This only for to make the periods regular. We can give.
So, should I say something here?
Yes. What
Ciproterol
did you
usually we give if they have excessive hair growth. Is it necessary to give ciproterol? Simple ossiples, won't it be enough in these patients with PCOS?
Yeah, I didn't get your point, madam. क्या कह रहे थे आप? You were
No,
saying
she has
something.
written whether ossipils with ciproterol to be given. If
हाँ,
there is clinical evidence of excessive hair
hyperandrogenism.
growth, yeah, otherwise not necessary. Simple
Not
ossipils should
necessary.
be. Yes.
Very right. So when she's got hyperandrogenism, then we can give ciprotron. But we can't give her ciprotron lifelong. That's what I say. There's a
Yeah.
big challenge here. We can't give them lifelong ciprotron acetate. But I think it can be
Even
done on case-to-case basis.
she continued one question like how long to give ossipils. I mean, again, this is
I have no. I think I leave it to the professor because I normally treat people take it till the time they become they deliver. But how
yeah.
about you? In your population,
Ossipils. So
I,
one thing people should understand: ossipils is not going to be a permanent cure. You can give it intermittently, and you'll have to tell the patients that this is not the treatment. Finally, it is lifestyle modification.
uh,
So I mean,
point taken.
only when they don't get their periods for 4 months or 5 months, yes, we'll have to give them withdrawal bleeding. As I've told earlier, at least 4 cycles per year is mandatory, so as to prevent the long-term complications like endometrial cancer, which is very important with hyperestrogenism.
Correct. So
Yes.
polyps, endometrial hyperplasia, all these things have to be checked, and we have to do her, around every few months her the insulin levels. We have to just keep a or do her oral GTT. So keep a watch on her. But I don't think we should give OC pills for how long is I don't have any answer.
Yes, no
Probably what
answer.
I you said, Dr. Latha, I agree with you. There's no
Yes, sir.
answer here.
So
Again,
then,
Ramesh. Yes,
yeah.
madam.
Shivani has written Diane 35 Stelia 35 Crimson. I mean, all are
Brand
equally
names.
same, I think, brand
Yeah.
names. So Ramya has asked, can we give myo-inositol for them to regularize the period?
So I think so. There is no recommendation of giving mayonnaise at all till now. I give, I do give. I give DCI MCI combinations. I give DCI MCI CoQ10 combinations, but they are not the recommendations. We give because after proper counseling, I give it to the people. But there are no recommendations that they do any magic. So
Yeah.
I don't think do it at your own discretion. The recommendations they say they don't work. So please go to the
Shivani,
ASHRAE
yes.
recommendations. They don't say that we should be giving it. Yes.
Shivani has written yoga, especially sun. I understand that it is Surya Namaskara, maybe. Salutation will be very helpful.
Yes. Yes. Yes.
Yeah. Any kind of exercise in any form.
Yes.
PCOS never go away. She's also said why chance of tubal obstruction is less in PCOS.
Huh, because these girls are young, number one, and these girls have no other pathology. PCOS by itself uh, doesn't lead to tubal blockage, no? So PCOS, they won't, the chance of having tubal obstruction is very, very less. And I suggest please go to the ASHRAE guidelines. There's one whole section devoted to the whether we should write people to do their tubal testing or not. And they have left it to our discretion. So Shivani ji, please go to the last appendix of the ASHRAE PCO guidelines and read that. They have covered your question very, very well. But in the PCOs, they have given the option open to you that you can may try a few cycles without it, but in a plus minus way. But I always carry out tubal blockage testing. So
So there is
does
a yes, yes, sir.
Ovaris
Yes,
Plus. No, Ovaris Plus is not meant for high AMH.
yes.
Not meant for high. They're all Ovaris Plus is not even recommended for any patient. See, we are giving. You just go H, HFEA, you go to Cochrane, you go to ASHRAE guidelines. In case we follow guidelines, none of them have said that these drugs they are doing wonders. So where they're indicated also. So here they're not indicated only. So you want to give it an antioxidant, but सबको कहता हूँ कच्चा आंवला खिला दो लोगों को. Nothing good like कच्चा आंवला. Kacha amla is very good. That contain all antioxidants. It is a powerhouse of gooseberries. I don't think that we should be giving an unindicated drug. यहाँ indicated नहीं है. POR you may give. Yes, madam. Coming to Saloni, over to you, ma'am.
Saloni has said if I think little bit away from this, but if egg retrieval process is done and embryos cannot be transferred due to PCOD, then does embryos get affected if they are not transferred for months?
Nothing. Nothing happens when it's the embryology procedure.
Freeze them. Yeah.
They'll be okay for even you come back after 2000 years, your embryos will be safe.
Your embryos will be.
2000 years they'll be safe. Nothing to worry about. But once they're kept in a good canister, in which you keep refilling the Ln2, and it doesn't have an atmospheric radiation ka exposure, they'll be safe. Nothing will happen to them. But government of India allows only 10 years. As per the guidelines, you only preserve them for 10 years.
Yes. Yes.
Yes.
So there's one question. I think she's from a patient. My weight is 90, height is 5.3. Should I try for pregnancy?
My weight is 90, I think. Why not? You
Definitely.
have to try for your pregnancy.
Contraindication.
Why would you talk for it? You can always correct any of us. We are all here. You can correct any one of us. You can always, go to any. I always say go to ChatGPT and ask ChatGPT. Or ChatGPT is a very good companion of ours now. When I get stuck, when I was preparing for this PCOS, I did go to ChatGPT and ask what are the common questions that that's going to ask me. So they told me that they will ask me these many questions. तो चैट जीपीटी का अच्छा तरीका है सवाल पूछने का बट आई थिंक मैडम यू मस्ट ट्राई फॉर इट आई डोंट नो योर एज बट you are slightly average Indian height 5.3, 90 kgs is on the higher side. The BMI is high, I feel. So I think we should try as early as possible. Meet a doctor and he will tell you, make some guidelines for you, a diet sheet for you, and try to lose weight. Fantastic.
Yes. So Shivani, I think this is the last comment. Shivani has said you have taken a wonderful curtain raiser on ASHRAE guidelines.
Yes, we had one. So I think beautiful. So Malaj, I think we met KP Singh is there, Archana is there, a lot of good friends we met. I think I'm done. Any other questions, madam, from your side? Anything which you like to ask me?
Just 1 second, sir. I think I'm exhausted with my questions after a long term. I think I have done with all. Um so that's all, sir. From my side, I think you did cover everything. I don't know whether Chat GPT asked you some more questions or
I
not.
did go to ChatGPT and asked, what is Latha
I am
PCOS?
not prepared from Chat GPT, definitely not.
I did go.
Nice,
To prepare
nice
from ChatGPT.
interaction. Yes, nice interaction from all the people who have
Yeah,
participated, all the delegates, giving lot
मजा
of
आया.
comments, which is yeah, maza hai, sir.
Guys,
Thank
भी
you for
मजा
that.
आया खूब मस्ती करी हमने and we learned a lot of things and please feel free to connect with us. We are both Latha and me. You have a Latha number also on the screen. You can always connect with us on YouTube, Facebook. Send us a WhatsApp. So my number is rolling below, as you can see here. My number is rolling below in the inquiry. So Latha's number is on the screen, so you can always connect us. It's wonderful meeting all of you, and I think it's a nice community we are creating where we meet people and we talk to them about things in their life. So thank you so much. Please take care, stay blessed, be happy. एक सवाल छूट गया है वीरा गायत्री हॉस्पिटल का दैट ओआई ऑन डे 10 follicle size is 20 millimeter.
अच्छा अच्छा बीच पे छूट गया हाँ हाँ
Actually इस केस के अंदर भी nothing much can be done. I think this is a spontaneous cycle, and PCOS are known to have thin eating. PCOS can have thick ET, they can have a thin ET. It is an androgenic ET here. अगर ये pathological thin नहीं है, then I think you can give them some sort of arginine. Arginine के sachet दे दीजिए, arginine tablet दे दीजिए. Give them sildenafil. You can give them PRP or GCSF. Though they are empirical adjuvants, but you can give them if you want to give them. And आई थिंक अगर इससे अगर बात नहीं बनती है, देन प्लीज ट्राई टू suppress their hyperandrogenism by giving them OC pills for 2 cycles. After suppression, the ED will become better. Or in case it is in case you are dealing with an embryo transfer cycle where the ET is not forming, do give them down regulation with decapeptyl or lupride. It will make them have better quality lining. So arginine you can give, PRPs, sildenafil, they're all empirical drugs. Don't लिखा नहीं है ऐसा करने के लिए, they're all empirical drugs. But when we don't get an answer, we try these things, and you can always try these things. So Ortho Flash videos, thank you so much. I 1 month off yes, you're right, man. You're right. You're right, Ortho Flash. We can give it for 1 or 2 months. It'll take around 2 months or 3 months for complete going, becoming better. So give it a minimum 2 months, make her periods become better, let her gain confidence. 2 महीने में she will run, lose some weight, and she'll become fitter. Cosmetically, she will look better, and then we can try the revolution induction. Keep things simple. चीज़ें कॉम्प्लिकेट नहीं करनी है, बड़े बड़े पीसीओ प्रोफाइल नहीं कराने हैं, इंसुलिन वैल्यूज नहीं करने हैं. डोंट फील एवरी पेशेंट has got CH. Keep life simple. That's all I like to tell you. So I think, Lathaji, I am done. We can say goodbye,
Yes,
and we'll connect
yes.
again after a few days.
Yes, sir. Thank you so much, sir, for giving me this opportunity to moderate this session. And I think it was nice taking up questions which are problems of day to day. For I think all gynecologists here and many of the patients or people are visiting, or online do face this problem. So I think you have done a given a fantastic view about how to manage PCOS. Thank you once again, sir. Very
Thank
happy and
you. Thank
connected
you.
with you and always listen to you, whether it's YouTube or content. It's really, really nice. Thank you
So
so
bye,
much.
guys, and have a
And
ball.
thanks,
Be
yes,
blessed
sir.
and be happy. Be happy.
Yeah,
That's what
thank
I
all
can
the
say. Always.
delegates and who have joined this YouTube. Thank you,
Thank you
sir.
so
Thank
much.
you so
Thank
much.
you so much. Bye. Bye.
Yes,
So we are ending it. Goodbye. Take
yes.
care. And be
Goodbye,
in
sir.
touch. Thank you.